Hi, this is Dr. Jay Bernstein, and I'm on with my daughter Gavriella. We're going to have a discussion about the VAXELIS vaccine, which I hope will be very enlightening to everyone. This vaccine is a 6-in-1 vaccine. It was fairly new. It just started in 2021, so it's only about 5 years old. And it's 6 vaccines in one injection, given in a 3-dose series. The indication for this vaccine is ages 6 weeks to 4 years, and it includes the 6 vaccines that are diphtheria, tetanus, Haemophilus influenza type B, pertussis, polio, and hepatitis B vaccine.
I have a friend who had her first baby about a year or two ago, and when she was bringing her baby in to get vaccinated, she had been starting an area of her life where she was already getting very health conscious, doing more research on her own, natural, all of that stuff, and so she had decided that she didn't want to vaccinate her baby for hepatitis B. The other ones she thought they were necessary, so she didn't opt out of those, but specifically hepatitis B she wanted to opt out of. So she told her doctor no. All the time she wanted to bring her baby for the doses, she told the doctor no. Then she had to switch doctors for separate reasons, and she was telling her new doctor that her baby did not have the hepatitis B vaccine, at which point the doctor became confused and said, well, it seems like your baby has actually had all of the hepatitis B vaccines. They are listed in her chart. So what seemed to have happened is that her old doctor had vaccinated her child without her consent. So my question is, do you think that this new 6-in-1 vaccine is going to make it more difficult for mothers who are beginning to differentiate between the different kinds of vaccines and maybe make it so that they just say blanket yes to all of them?
I think for sure that's going to happen because, especially in a time where people are becoming more concerned, I would say, about vaccines, more aware that there may be some possible adverse problems. It seems to become just people more awake regarding the vaccines right now, and those who want to be more discerning, this is sort of the pharmaceutical answer saying, well, we're going to lump all these into one, and you may not even know that there's hepatitis B in this vaccine, for example. So, yes.
Well, is it a safe vaccine?
Well, when you look at safety, you want to really look at the highest quality study. And studies, you can put the studies in like a pyramid, where the bottom of the pyramid would be the lowest quality. So went to the very peak on the top of that pyramid, and that would be the randomized controlled trial. So the question is, are there any randomized controlled trials with a true placebo available? And the answer is no. There are none.
Well, why is that significant?
Well, because the randomized controlled trial with a true placebo is really going to tell you the most information regarding safety. When you're looking at any outcome in science or medicine, you want the RCT, the randomized controlled trial with a good placebo, and this is so much more important in a drug that's going to be injected into kids. And the other thing is that they really didn't even look very far out. In the package insert, in the VAXELIS package insert, it only describes that they went out for 5 days. There was one article that I was able to find in the literature, they went up to 2 weeks, but that's really the max.
And what do they say that the side effects of this vaccine is?
Well, the side effects are pretty concerning. Before you even talk about the side effects, I want to just point out in the package insert, it talks about that anybody who's providing this vaccine needs to have epinephrine and also other equipment available to treat an acute anaphylactic reaction. So that's one thing. Anybody to worry about it, then the package insert wouldn't tell you that they're mandating having epinephrine available when this is given. But in the package insert, the insert is telling us that one of the components, which is tetanus, causes Guillain-Barré syndrome and brachial neuritis. Now, they use the word cause because they had to. If they could use the word associate, in other words, tetanus is associated with it, they would have used that, but they didn't. It's in the best interest of the drug company not to really providing smoking guns unless they have to. So it actually says at point blank, tetanus causes Guillain-Barré syndrome, which can cause permanent paralysis. Often it's temporary, but it can be permanent, and it can be very severe. The severe cases where people can be on a ventilator, people are in a wheelchair on an indefinite basis. So it's not an insignificant problem. It also says it causes apnea. We have a book coming out in the fall that hopefully everyone will read. And in our book, we do show that there were some studies showing that infants, especially premature infants, can have apnea caused by vaccines, and it mentions this in the package insert. It also causes immune and nervous system issues, and also they list prior reactions that they describe as that needs careful consideration of possible risks that include collapse, HHE, which is a hypotonic hyporesponsive episode within 48 hours, and seizures within 3 days.
Well, so these are the side effects, but would this vaccine provide protection to everyone?
Well, in the package insert in section 5.6, it just says point blank, no, it does not. It does not provide protection to everyone.
And what ages did the studies look at for safety?
Well, they looked at 6 weeks up to 15 months. That's what they reported. Again, going up to only 5 days out. But even though they report the safety up to 5 days, from 6 weeks to 15 months, they do say it's indicated up to 4 years of age. So between 15 months and 4 years of age, there's no data.
So then why is it indicated for up to 4 years?
You know, it's a good question. What makes the question even stronger is that the package insert tells you that section 8.4 says that it's not indicated from 5 years to 17 years. Why? Because there's no data. But yet there's no data from 13 months up to 4 years, but the company says it's indicated from 6 weeks to 4 years. So again, 13 months to 4 years, no data, it's indicated. Above 5 years of age, from 5 years to 17 years, no data, they say that's why it's not indicated. Makes no sense.
Right, and we said that that the drug company observed the subjects for adverse reactions for 5 days and in one case up to 2 weeks. But this is obviously too short of a period of time to make a diagnosis of something like autism. But what about side effects? Did they find any side effects that may be consistent with an emerging diagnosis of autism?
Absolutely. There is signs and symptoms that are consistent. Now, let's just say if hypothetically you find some signs and symptoms that they describe in a 6-week or 8-year-old, it's really too early to diagnose autism anyway. But if you look at what these side effects are, this definitely could be manifestations at that age can be consistent with autism. The kid that age, say 6 weeks, 7 weeks, 8 weeks, they have decreased appetite, they're not eating, they're sleeping, they're not waking, they're not easily arousable, constant crying, irritability. These are side effects after the vaccine, and these are often side effects that people report after a vaccine when the child later develops autism.
And why do you think the drug company did not look at longer-term problems after administering the vaccine?
Well, longer-term problems, if they looked out, years later and they found some of these neurodevelopmental, neurobehavioral problems, chronic infection, acute infections, in other words, ear infections at the age of 4, 5, or 6 years old, or pneumonia. They look at these long-term problems and they found what appears to be causation by these studies, then that would obviously destroy the drug. They wouldn't be able to market it, sell it,
And if you were looking at longer-term adverse reactions, what sort of things would you find that were indicated to be a result from this vaccine?
Well, I would want to look at some of the common things we see in kids, or the more serious problems. You want to look at ADD, ADHD. You want to look at autism, on other neurodevelopmental problems, neurobehavioral problems, neurodevelopmental problems, acute infections, chronic infections, allergies, atopic disease, asthma. You want to look at the whole gamut, and that takes years. And if I were a drug company, and if this was certainly a potential, then I would want to eliminate that potential by just looking 5 days out, and then you're pretty much guaranteed not to really find anything because that's really what they show.
And you had mentioned earlier that the placebo was not a true placebo. So what did they use for the control group?
They used other vaccines. That is the control. And they found death rates of 0.1% for the control, 0.2% for the VAXELIS. The control, again, being another vaccine. So 0.1%, 0.2%, that's 1 in 1,000 or 2 in 1,000. That's pretty high rates of death there.
Right, especially compared to the general population death rate, correct?
Yeah, that's much higher than the general population. So, yeah.
And what did they say that these causes of death were?
Well, looking at, again, the biological plausibility with what we know to be true from the studies that we're publishing in our upcoming book, the cause of death that they're describing certainly fits quite well with the some of the problems that vaccine can cause. For example, let's look at aluminum that's in this vaccine. Aluminum is put there as an adjuvant, which means it helps it be theoretically more immunogenic. If you have aluminum in this vaccine, and all the 6 vaccines, it enables them to work better. Okay, which the data on that's very sketchy. But let's just say we believe that it works better, then aluminum in a human being causes immune dysfunction as well as being a neurotoxin. So immune dysfunction means they don't have a good immunity for, say, other things that are not in the vaccine. And that would set them up for an infection. And so one of the causes of death, the first one they list is sepsis. Sepsis is a blood infection. If people die of a blood infection, that means that is not able to control that infection. And that can be caused by an immune dysfunction, i.e. aluminum could be a biologic plausibility to cause that. And as we know also in some of the studies we outline in our upcoming book, that SIDS has been found to be an increased risk after vaccine. So they list that as a cause of death here. And asphyxia also, which is low oxygen, which that can be caused by apnea, which we also show in some of the studies in the upcoming book.
Let's talk about the aluminum. How much aluminum is there in this vaccine?
There is 319 micrograms of aluminum.
And how much is recommended?
There's really 3 different government standards. The ATSDR is probably the best one to go by because it's based on science. They titrate based on the age of the child. So, for example, the ATSDR, which stands for Agency for Toxic Substances and Disease Registry, the ATSDR says that any amount greater than 3.3 micrograms per day in a newborn is not recommended, and anything more than 7.6 micrograms per day in a 6-month-old is not recommended. Anything beyond 9.3 micrograms per day is not recommended in a 12-month-old. And this has 319 micrograms.
And we also have the U.S. Department of Health and Human Services also recognized aluminum as a neurotoxin, correct?
Right. So the HHS in the Federal Register, June 2003, they say that any amount of aluminum is concerning because they recognize that aluminum is a neurotoxin. So there's the second one. I said there were 3 standards. That's the second one saying, well, any amount's bad. The third one is basically which is what the CDC will use for the vaccine schedule is 850 micrograms. And where did they get that number from? That came from the 1968 Federal Register that says anyone should not have any more than 850 micrograms per day. 850 well, what that's based on, we don't know. I looked into it. I couldn't find any science behind it. And it's a 1968 standard. So the vaccine schedule is using the 1968 standard of 850 micrograms. Meanwhile, the ATSDR is telling us, even for a 12-month-old, don't take more than 9.3 micrograms per day.
Let's discuss some of the other ingredients in this vaccine. Is there formaldehyde present in this vaccine?
Yes, there is. Formaldehyde has been shown to cause autoimmune problems like asthma. It's linked to nasopharyngeal cancer, myeloid leukemia. Mm-hmm.
And what about polysorbate 80?
Polysorbate 80 is in this vaccine as well, and that is well known to cause increased permeability of the blood-brain barrier. What that means is that it opens up channels for toxins to go into the brain more efficiently.
Toxins like aluminum.
Right, and aluminum is a neurotoxin. And if you think about it in a baby, even a 6-week-old baby, the blood-brain barrier is not fully developed, especially if it's a premature baby at 6 weeks. And then you inject that into a kid. Now the aluminum that's a neurotoxin more efficiently gets into that brain, and it's a developing brain, which is more susceptible to the toxicity because it's developing.
You had mentioned earlier that doctors are recommended to be aware of possible acute life-threatening allergic reactions. What causes that?
Well, a good candidate for that would be the bovine albumin that's also in this vaccine.
Bovine means from cows, correct?
Right, and the significance there is that it's a foreign protein. You're putting a foreign protein, a different species, injecting into the human, which means it's very plausible, and there are cases where people get acute anaphylactic allergic reactions.
Can it cause anything else?
Well, one of the things that we need to look at is this emerging disease called alpha-gal syndrome. Alpha-gal syndrome is a red meat allergy. It's becoming much more prevalent. It's an emerging problem. In some states in the Midwest, even it's up to we find the incidence of this is up to 15 to 20% of the population. But and what happens is you have an immune reaction to this protein. The protein is a non-primate mammalian protein, and then that's what bovine is. The bovine albumin is a non-primate mammalian protein, and so the proteins do look similar. The protein is called galactose alpha 1,3 galactose. So that this protein that's been implicated for alpha-gal syndrome looks very similar stereotactically as the bovine albumin.
Well, I had thought that this was caused by genetically altered Lone Star tick bites.
And there's a lot more evidence of that. There's scientific evidence of that. There's no scientific evidence of the bovine albumin yet. It hasn't been looked at either way. So we don't know. Could it be both the problem? Possible.
And what about antibiotics? Are there some in the VAXELIS vaccine, and is this a bad thing?
Well, ostensibly you think, an antibiotic in the vaccine, maybe that's good. What's wrong with an antibiotic? It kills bacteria, right? The problem is the antibiotic choice. So polymyxin B and neomycin are the two antibiotics that are in this vaccine. Both of those are toxic when injected intramuscularly. So neomycin, that's never given. I am clinically trained and work as an emergency medicine physician. I never have the opportunity to give an intramuscular injection of neomycin and polymyxin because even though they're good antibacterials, they cause toxicity to the human host.
Well, I thought these were in antibiotic ointment.
Well, they are. If you give it topically, there's very little absorption. So the toxicity of neomycin, which is hearing loss, ototoxicity, kidney failure, nephrotoxicity, that would be much more of a problem when you inject it, not really a problem when you put it on your skin. Same thing with polymyxin, which is causes neurotoxicity, toxic to the brain, and nephrotoxicity, toxic to the kidney. You don't want to inject that into people because there are other better choices, safer choices, but yet they are in the vaccine which we are injecting into babies.
So just to sum up, this 6-in-1 VAXELIS vaccine has never been shown in any randomized controlled trial with a true placebo to be safe, and it has been randomly seemingly assigned the age range of 6 weeks to 4 years, with no data whatsoever from 13 months to 4 years, and we have no idea why it's not recommended for people over the age of 5. It has 319 micrograms of aluminum, a known human toxin, as well as formaldehyde, polysorbate 80, polymyxin B, and neomycin. So it sounds like personally, if I had kids, and God willing, when I do one day, I certainly would not want my children to be injected with the vaccine. And we hope that anyone watching this video has been adequately informed about this vaccine and will take this information into account when deciding whether or not to vaccinate their own children.
Great, yep. Agreed. Thanks.
Thank you.